the Toronto Star, I'm Saba Itazaz, and this matters. The pandemic catapulted us into the future, the one we imagined where the computers rule and life is a collage of digital windows. Just like other aspects of our life, telemedicine looks like the future of healthcare. Is it a future that we want? Over the past 2 years, along with all the other joys of the Zoom life, COVID-19 has brought a massive shift in the way we interact with our healthcare system. If you're a millennial like me, it seems great, doesn't it? If you have a sore throat, you don't have to wait to see the doctor. Instead, you can just download an app and Zoom with your GP, who, relying on your description of your symptoms, can prescribe what you need. You've saved yourself a trip to the clinic, and you haven't made other people sick or caught something yourself. I'm still doing those virtual visits with my doctor, and it looks like telehealth is here to stay. According to a Walrus piece by Carine Abouseif, a recent survey found that the majority of physicians plan to keep using the system once the pandemic has receded. But the rise of virtual care has also raised important questions about healthcare in this country, including what exactly a doctor is paid to do, what quality care looks like, and how do we help those who have the least access to it. Carine has explored all these aspects, and she joins me now to talk about the past, present, and future of virtual healthcare in Canada. Carine Abouseif is a features editor at The Walrus. Hi, Carine. Nice of you to join me today.
Hi, Saba.
So let's start from the basics. How did the process of going to your GP for a checkup shift during this pandemic? Can you take me through the process a little bit?
Yeah. So before March 2020, if you had a stomachache and wanted to get it checked out, you would call your family doctor, book an appointment, maybe for a few days out. On the day, you might leave your workplace because many clinics are usually only open during traditional work hours. And then you'd commute to the clinic, and then you'd sit in the waiting room for several minutes, if not longer. And then you'd finally see your doctor. In March 2020, that suddenly changed. All that got condensed down to a phone or video call with your doctor because we were trying to reduce transmission of the virus. And for a lot of people, that was incredible relief, but for others, maybe not so much.
There were pros and cons to both. What were some of the benefits we saw immediately as a result of this virtual shift? I do know it made things quite convenient for me while I was working.
Yeah. So like you said, for a lot of people, the convenience of it was amazing, especially if you didn't have paid time off to park your car, spend a few hours at a clinic, or even find someone to watch your kids if that's what you need. To replace that with a phone call you can make from home means you don't have to put off that visit until you can manage to arrange that time off or that childcare. So in theory, that means better access. And in theory, there's also great advantages for people who live in remote areas, or if you're trying to access a specialist that's a couple of hours away. Some research also suggests that using phone calls instead of in-person visits could help catch symptoms in places like long-term care facilities, so decreasing down the line hospitalization for those residents. Another thing that happened in the GTA here is that hospitals were setting up something called virtual emergency rooms. So if you were worried about something like a sprain and you needed to be seen today, but it wasn't a life-threatening issue, you could put yourself in line to be seen by video by an ER doctor. And so that has potential to streamline an area of medicine that is quite heavily burdened right now. But again, that kind of thing has pros and cons as well.
Right. And we're relatively late to sort of adopt the system, as I've seen from your piece. And I'm sure there have been pros and cons. And like you said, what have been some of the biggest challenges that came up or could come up with virtual care? For example, I was reading in your piece that there's no mechanism at the moment to sort of distinguish who needs actual personal medical attention or whether, it should be a virtual appointment, and it's kind of left up to individual doctors.
Right. And so I spoke with a few experts and doctors for this piece, and one of the things they all agreed on is that some things just cannot be diagnosed over the phone or via video. Abdominal pain is an example that came up often. Many of them said you have to, at some point, touch the patient's belly to feel for lumps and bumps and things like that. However, even as more and more people were getting vaccinated and in-person interactions have become relatively safer since March 2020, at least for most people, I've still seen quite a few complaints from people who want or need to be seen in person by their doctor, but have been turned away and told to come in, via phone or video. In fact, here in Ontario, the government recently reprimanded clinics that are still operating as virtual only. The result of that virtual only approach has actually been an increase in emergency room visits in Ontario, which is sort of the opposite of the intention of virtual care.
Why is that? Is it because there were initial misdiagnosis or because the proper care was not given because of the virtual mechanism?
It seems to be a bit of both. So patients who maybe feel they need to be seen in person and aren't able to get that in-person appointments are just saying, you know what, I'm just going to go to the ER. And then sort of the other side of it, when I did speak to a few ER doctors, they said to me that some of the patients they were seeing were people who had been initially misdiagnosed over the phone, like nobody looked inside their ear or touched their belly. And so they came into the emergency room for these conditions that had been kind of misdiagnosed earlier on in the process.
Right. But at the same time, we're kind of seeing this permanent shift in how we do things and how we see things. And we're seeing this around offices and workplace culture, how we interact socially even. So is this potentially inevitable? Could virtual healthcare or parts of it become a permanent thing?
Totally. Absolutely. A survey over the summer actually found that the majority of physicians say they plan to keep up some aspect of virtual care. So maybe not everything, but potentially some kind of hybrid approach is in our future. Some of that does have to do with how doctors get paid in each province. So in Ontario, before the pandemic, doctors weren't paid for phone calls in the same way that they are now. And there are talks at the moment to make that new approach to billing permanent.
Mm-hmm. And this is something that other countries are already doing. Can we talk about some successful models around the world? And we're kind of behind, right?
Yeah, so that's definitely, again, like one of the things that quite a few of the experts I spoke to agreed on. And one of the biggest issues we have here is the sort of lack of integration between clinics and even provinces and territories. So if you visit a walk-in clinic this week and then you go to your family doctor next week, the information from all those visits isn't necessarily integrated in one place, which kind of presents problems for people who are on a number of different medications that could interact with each other. And it's also just extremely tedious. So what's the point of doing a virtual visit with your doctor if you still have to go to the clinic to pick up a requisition, a form that's like a piece of paper, and drive it over to the lab? You end up kind of chasing down things that are, print records or things that are electronic records and trying to consolidate them yourself. And adding virtual visits into all this kind of exacerbates that fragmentation. And there are people working on fixing this, but it's not where it needs to be. And so Norway and parts of the US have done much better than us on that. The US has something called the Kaiser system, which is considered a world leader on this, but I don't like to talk about it too much because it's funded by a monthly premium. So it's a bit of an apples to oranges kind of thing.
It's a different model.
Yes. Norway is a better example, I think. They have a centralized system where any doctor can log into the same system and see an entire patient's history from every different clinic that they've been to, all the lab tests, everything. And the reason they're just, further ahead than we are is just that they've been working on this for far longer than we have.
Right. And they've managed to make the integration quite seamless. But you also write about how Canada actually was kind of a pioneer in long distance healthcare. Could you give us a little bit of a historical background?
Yeah. So one of the cool things I learned while reporting this piece is that actually Canada used to be a leader in experimenting with kind of healthcare from a distance, which kind of makes sense given the scale of the country.
The area, yeah.
Yeah. So one of the things I learned, for example, is that in the 1950s, radiologist Albert Chartres was one of the first people to send X-ray images between hospitals in Montreal. In the 70s, another researcher in Newfoundland used telephone consultations for people in remote parts of the province. And I think that same university that he worked at, a Memorial University, also worked with NASA on a satellite that helped transmit audio and video between hospitals. So some really cool groundbreaking stuff at the time. Since then, it's not exactly clear to me why we fell behind, but I guess it has to do with the ways in which different provinces handle healthcare differently. We also have important but kind of cumbersome legislation to protect patient data and privacy. For example, I recently moved from one family doctor to another, and I had to sign paperwork that gives my new doctor permission to access the records from my old doctor. If we're all kind of hopping around doing virtual visits with different walk-ins and clinics and ERs, that kind of gets cumbersome, I think, and impossible to track.
We'll be right back. And privacy issues and the legislation around it is one factor. And like you said, you talked about this lack of coordination generally, right, between provincial healthcare systems. And we saw the pandemic kind of highlight some of that. So has the growth of virtual healthcare also kind of raised up some critical issues within Canada's healthcare system and what we might need to change? And this coordination stuff, for instance, would, an implementation of the virtual healthcare system kind of help more or disconnect further?
So it could be either or, depending on how we move forward. So I think for us to kind of reap the benefits of virtual healthcare, as opposed to having it kind of backfire, we need to have that interconnectedness between systems, as you say, but we also need something a few experts referred to as continuity of care. And what that means is that even if I'm going to virtual emergency rooms and having a specialist monitor one of my lab readings and getting my prescription filled through an app, I still need to have a main point of contact, like a family doctor who has access to all this information and who occasionally does see me in person. This is the person who would, perform a pap smear or notice if I showed up one day and I was like 30 pounds lighter unintentionally and so on. But what we know is that something like 15% of Canadians don't have a regular doctor. And that gets worse depending on what part of the country you're in and how remote it is. So continuity of care is something that needs to be addressed before we get excited about other aspects of virtual care, like apps that monitor your blood sugar or whatever.
And you're talking about accessibility, which I want to get into with you as well. You do point out some red flags. There's an argument that this system might actually help healthcare become more equitable and accessible for the most vulnerable. But at the same time, there is some risk that communities that they're saying it's designed to help could actually be the ones left behind. So could you talk about some of those barriers that could occur for those communities?
Yeah. And so a lot of these risks come when we stick to a sort of virtual only approach. And for example, when the pandemic started, the South Riverdale Community Health Center here in Toronto was literally handing out cell phones to people who didn't have them so those people could access healthcare because those patients were not given the option to come in person. It's important to remember that not everyone has a cell phone. Not everyone has a Wi-Fi connection or even at least a good Wi-Fi connection. So even if you can have a video call with your doctor, maybe it's choppy. Maybe you don't want to discuss, a serious cancer diagnosis or something like that over a choppy connection. There are also remote Indigenous communities where internet access is still much worse than the sort of baseline that the federal government has set out. And then finally, not everyone has privacy at home. So this has come up a lot with mental health care, for example, where people are taking therapy sessions in their car because they don't have privacy at home. So giving people options, especially now as the threat of transmission is decreasing, is something that is turning out to be quite important.
But also, in a way, it's a catch-22 situation because essential or gig workers, for example, who we've seen have had issues being able to go to a doctor because they can't take the time off. And we also saw that inequity play out in how they were impacted by COVID-19 and their access to vaccines. So this could potentially help them out. But at the same time, they would need access to devices and to good internet, right?
Yes, absolutely. So I know tons of people who love that they can, step out of if they're working a retail job, for example, like step out for a second just to take a call with their doctor, maybe fill a prescription, check in on how medication is working, things like that. Those things absolutely don't need to be done in person. And that person doesn't need to, cancel their shift for the day just because they, need to check in on a prescription where they're basically just going to say the prescription is doing great. And so, yeah, absolutely, there are ways that this will improve access for a lot of people.
Okay, I'm going to change the topic away from this for a second. You also talk about the monetization, or what you interestingly said was the Netflixization of healthcare during this time. Can you explain that a little bit?
Yes. And so actually, I'll give credit for that Netflixization of healthcare quote to one of the experts that I spoke to. And so what's happened is that in all this chaos, a lot of pay-for-service apps have jumped into the fray. These are apps where you would pay a monthly premium, for example, and then you can access a doctor as often as you'd like, sort of like a subscription service. There's been a lot of investment in Canadian healthcare apps through the course of the pandemic. Someone even once told me this area is kind of like, quote unquote, the new cannabis in terms of how much excitement it's attracting. The problem with this kind of thing, though, is that, first of all, we already have publicly funded healthcare. And I mean, personally, I think we should be putting our resources into making that work for everyone as opposed to funneling money into something only wealthier people can access. But secondly, some of those apps and sort of electronic record systems end up sharing your de-identified data with drug companies. Some of them also have in-app ads for certain medications. And research has shown that this can result in patients asking for and getting medications that are either maybe unnecessary or possibly just more expensive than the generic because that's what's been marketed to them. So it's kind of a domino effect. And then also, and this might feel kind of counterintuitive, but more medical attention isn't necessarily always better. Doing more tests, getting seen by a doctor more and more, doing more scans can sometimes kind of create more patient anxiety than is necessary. And it can down the line lead to prescriptions that are also unnecessary. So that's something that, unfettered access to, a subscription style healthcare app may not be great for.
It could be a pitfall. And, there's something to be said for the argument of quality over quantity. So that's an interesting point. So what's next? What do we see as the future of virtual healthcare in Canada? Can we make this work and use this sort of opportunity to make healthcare actually more equitable and more accessible for everyone?
Yeah, some of the experts that I spoke to are quite optimistic. The Canadian Medical Association has a virtual healthcare task force, and I spoke to one of its members extensively. And they put together this report in February 2020 where they provided some recommendations. So this was even before the pandemic had landed here in Canada. And the recommendations include creating like a nationwide patient registry so that each person's data would be sort of attached to a personal number and follow them around wherever they go, province to province. So if you see a specialist in Calgary, but you live in Yellowknife, all that information would still be accessible no matter where you went. But that also is kind of more complicated than it sounds. They're also encouraging provinces to develop more standardized recommendations for what can and can't be handled in person. And that's something that's starting to happen quite a bit. Another expert I spoke to is actually hoping that we can just make the whole thing more intuitive. The analogy he gave me is from banking, and I kind of love it. You know that if you need to transfer some money, you can probably do it from home. But you also know that if you want to open a mortgage, it might make more sense to actually talk to someone in person. Maybe you just want to go sit down with someone at the bank. That's a place that we could probably get to with virtual healthcare, where people know what needs to be done where, but also they kind of have a choice. You still have a choice to go transfer money at the bank if you want to. There might be fewer hours when you can do that, but it's still available to you. And so I think that's where people are hoping to see this go.
That's a really interesting analogy. And from what I can see, there's a lot of promise, but there's like a lot of regulation and more sort of framework building required to make this a reality on the lines of what you speak of. Thank you so much, Carine. You've been so insightful. I really appreciate your time to come here and explain this.
Thanks so much.
I was talking to Carine Abouseif. She's a features editor at The Walrus. That's it for today. Thanks so much for listening. I'm your host, Sabai Tazaz. The This Matters team is Brian Bradley, JP Fozo, Matt Hearn, Morgan Bucknick, Raju Mudhar, and Sean Pattenton. Our music is by So-Called, Mike DeAngelis, and Sean Pattenton. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com/subscribingmatters. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.